So great to see you again, Dr Mahesh. Thank you so much for your time. Would you like to just start by giving us a bit of background about you, who you are, what you do?
Sure. So thank you for having me here to the podcast. This is my first podcast, so good opportunity to explain myself as well. So my name is Dr Mahesh. I'm a pediatric consultant and I'm an allergist as well. Moved to Dubai from the UK and working at NMC Royal Hospital at the moment. My main thing in UK was I did train in the pediatric as a pediatrician first.
Yeah.
And then I did training in pediatric allergy as well. At the moment in Dubai, especially if I look at my allergy subspecialty, it's kind of evolving.
Yes.
And even in UK as well, it was emerging branch.
Yes.
And I'm really glad that I got an opportunity to work in Dubai and to explore what I can give to the, in terms of patient base and to the public, and kind of trying to bring new things from the UK.
So have you found there's quite a big demand for paediatric allergy services in Dubai, in the UAE?
That's a very good question. When I started in Dubai first, some of the tests, for example, doing the allergy testing, skin prick testing or the blood testing, people are now getting more aware about it. And I'm really glad that, we are kind of marketing it as well. And it's kind of re-education for the patients and some of the colleagues, because they might not have seen these things. So yes, definitely there is a more, I would say, opportunity and good for the patients as well.
And how have you found the quality of the healthcare system in Dubai so far?
I would say it's evolving, and it's evolving very fast. I mean, every day I can see new things coming up. All the hospitals everywhere, to be honest. I think they want to bring the best from all over the world, and medical tourism as well. Like I read in the news, lots of people come here in Dubai to kind of get the best possible treatment. So I think it's a great future here, to be honest. And I'm really happy that I'm kind of part of it.
How's it going in your job at NMC?
So team has been brilliant, quite supportive, and they do want me to develop the pediatric allergy services. I'm getting the support from them as well. And I think even some of the things nobody has done before as well. So it's kind of starting from the beginning. Okay, I want this, or we'll start this service, then explaining to the people. So it's been like kind of 4 or 5 months now. So
It's been 5 months now you've been at NMC.
It's been 5 months now, nearly 5 months now. I would say that going into right direction. Obviously things do take time if there is no base from before, but they are going in right direction. So happy about that. I'm trying to introduce new services as well. And I already done that, couple of services actually.
Okay. Could you tell us a bit more about that?
So just to kind of give an example, antibiotic or medicine allergy, like drug allergy. There has been, just to give a kind of example, augmentin or amoxicillin, very common drug. Kind of everybody knows about it. And when they go to doctor will prescribe these medicines. Now we do see lots of patients coming in with my child has amoxicillin allergy or augmentin allergy. But there has been a research, 95% of those allergies are not true allergies. If you label them at early ages or younger ages, it's difficult when you become adult. Then they take that label with them all the time. Then when they go to hospital for any emergency, for anything, your antibiotic window is very limited. Once you label them as allergy. So what I'm trying to do is, I'm trying to delabel them. So whenever I get opportunity, if I see somebody with for example, augmentin allergy, obviously after taking the detailed history and everything, if I feel that that's not true allergy, so I do the challenge test. So I bring them to the hospital or maybe in the clinic when they're completely well and actually give the medicine and monitor them over 3-4 hours. To see if they develop any reaction or not. But as I said, 95% of the time, they're not true allergies.
Really?
Yes. And it's interesting because then going forward, they don't have to worry about it. Because in parents' mind, they are thinking all the time, my child is allergic, my child is allergic. But actually, they're not kind of, allergic. And same goes with the food as well. I see sometimes 3-4-year-old children, and they're not eating particular food because they feel that the child is allergic to that. It might not be the true allergy. So again, I do the same thing with the food as well. For example, peanut allergy, very common kind of in European countries and all over the world actually. So give him that food in the hospital in controlled environment.
Yes.
And that's the best test.
So I wanted to ask, the children that have the allergies with the antibiotics, you find out that they haven't actually got that allergy. Like how did that come up in the first place?
Just give kind of example, if they come with the cough and cold or any infection, they get the antibiotics, and maybe after 2, 3 or after 4 days, they develop a bit of rash. Now that rash might not be related to the antibiotic.
Right.
It might be just part of the infection. Any infection can give you some rash.
Yeah.
And then at that stage, they get labeled as, oh, this is because of the antibiotic.
Being extra cautious.
And then they stop their antibiotic and give different antibiotic. And then that label keeps with them all the time. So how I decide is, again, what kind of reaction they have. When was the reaction?
Yeah.
Was it after immediate reaction?
Yeah.
Or was it late reaction? So depending upon that, then we decide, can we challenge them? But most of the time, this is the reaction they get. Bit of rash or a bit of diarrhea or something.
And it wasn't
like
actually
that.
to do with the antibiotic.
Exactly.
Yeah.
It's not
and I suppose,
necessarily
because what you said, like it will go through with them all the way to when they're an adult, and then it can be difficult to treat if they have
It's very difficult. Imagine
if they have certain
20-year-old adult goes to emergency, very sick, on their electronic system record. It's labeled as allergic to augmentin. Now, in the acute situation, nobody's going to challenge them. Obviously, anybody will be a bit precautious. Oh, he's allergic, so let me give different antibiotics. So that label continues for longer time. And then there is antibiotic resistance and lots of things are coming up. So that doesn't help as well. So to be honest, I'm really passionate about delabeling. I really do try.
No, it's really interesting. And I can see how that's not really in a lot of people's awareness. Like even me, I used to be a nurse like 10 years ago, but I didn't even think about this.
Yeah.
So is there any other projects you would like to just mention about?
Yeah, so other thing quite common is we call, kind of allergic rhinitis in medical language. But if I want to explain, it's kind of more nose congestion all the time. Sometimes itchy eyes as well. And quite common we call as house dust mite allergy. But we diagnose the house dust mite allergy. We'll give symptomatic treatment like use nose sprays, antihistamines. But the thing I focus upon is immunotherapy. It's like a marathon. If you want to run half marathon, every day you practice and it takes longer, 3-4 months, and then you can run the marathon.
Yeah.
It's same like immunotherapy, if I want to explain. Like for example, if you have a pollen allergy or cat allergy, for example, you give that small amount of protein every day for at least 2 to 3 years, so that your body is building the kind of strength to fight those allergens. So that's the one area I'm focusing as well.
What was the main reason you decided to relocate to Dubai?
I would say that one of the reasons was new challenge. I was working in public-based system, so I thought that, this is the probably best time to explore. I heard lots of things about Dubai as well. With my specialty, I thought that there is a scope to kind of expand. So that's from professional point of view. And other thing was, I guess, my parents are in India as well, so it's near in terms of family point of view. I can visit them more often now. Weather is great as well. You can see now.
It's only 3 hours away, isn't it?
Yeah, 3 hours. And I can go if I get 3-4 days off.
Yeah.
I can just go and come back. So that's one of the things as well. Overall, I heard lots of things in terms of, quality of life, and the healthcare sector is expanding as well.
How's your family settling in? How old is your children?
So my daughter is 8 and my son will be turning 4 soon.
Wow.
So initially my daughter struggled a little bit, kind of couple of months, but she had made new friends here now.
Yeah.
And that age, I suppose kids, they learn or they get adapted quicker than us.
Yes.
That's what I noticed. So they're enjoying here.
Yeah.
Schools are similar, like British curriculum and UK as well.
I hear really good things about the schools, like from the doctors that have children. They all comment on how advanced the schools are.
Yes. I mean the curriculum and I would say more innovative as well.
Okay.
And trying to keep up space with the current study patterns, or they're trying to develop kids for the future challenges as well. So they're happy. I would say they're happy.
And how was your experience working with Allocation Assist?
Again, very good question, and I really want to say thank you to you and your team. When you are outside Dubai, you don't know what is happening there. And it's like, I would say, guiding. You kind of rely, my whole experience in terms of, because I don't know which hospital to go, or because there are lots of hospitals, lots of clinics as well. And when you're outside, you have no idea what is happening in Dubai. Or if somebody your colleagues is working, you might get some information. But I think in terms of Allocation Assist, finding the best possible job, licensing process. Again, I would say that it's not really straightforward. I think differs upon the specialty, but overall experience has been great and very smooth. And I was lucky that I kind of got the job quickly as well. I'm enjoying it so far. So thank you once again.
Thank you so much. And how would you say your quality of life is here in Dubai?
Initially, it was, I didn't know much about Dubai. So a couple of months it took time in terms of getting adjusted.
Yeah.
And I think for everyone who is coming new to the Dubai, first few months you might find a bit challenging.
Yes.
But once you pass that period, it's different. You know, you can try to kind of accommodate your work-life balance, go for the exercise, lots of things to see in Dubai.
Yes.
Especially on the weekend and with the kids as well. So many things and activities to do. Going for the swimming and gymnastics and my daughter is enjoying that. So yes, you do get a lot of time. You just need to find your work-life balance perfectly. Safety-wise, I would say it's the safest city. You can travel at any time, even in the middle of the night as well. And it's lively city. 24/7, some activities are going on. I'm enjoying here.